So I have, along with the Anti-Racism Action Plan and the work that entailed, I also have 3 projects that look at the TRC's calls to action 18 to 24, which look at health within indigenous communities. And the first looks at comparative aspects of truth and reconciliation, or what countries have done internationally to facilitate redress. So I look at Canada, New Zealand, Australia, Rwanda, and South Africa, comparatively looking at the research that's been done out of those countries and how Canada might incorporate some of those calls or incorporate some of their processes in order to meaningfully move forward with calls for reconciliation and redress. The second study that I have seeks to look at perspectives of reconciliation according to different associations of indigeneity, so people who are registered, non-registered, and varied recognitions of Aboriginal title, to understand what reconciliation means to different groups of Indigenous peoples and what relational outcomes might be appropriate in the Canadian context. And the third study that I have consists of looking at an exploratory approach with communities in northern Saskatchewan and adverse health impacts which may be associated with mining or mining extraction in those communities. And this is one of those projects where we are adapting our publication output to include infographics so that the people at the community level might be able to understand what health impacts, more than just anecdotally, what health impacts are present, and then how they might take that up to advocate for either increased protections or increased environmental assessments as mining extraction moves forward.